Presatovir, it's fusion inhibitors directed against respiratory syncytial virus. We conducted two phase 2 trials trying to, randomizing patients to treat RSV, URI, or upper respiratory tract infection versus lower respiratory tract infection. This is in these two phase 2 trials. Unfortunately, we had a negative result on this trial where Presatovir did not meet the primary endpoint of reducing RSV viral load as well as reducing lower respiratory tract complications in this trial, at least for the upper respiratory tract infection trial. But we learned quite a bit from these trials where we learned that in order to treat respiratory viral infection, not only RSV, we have to act quickly and early on before patient progress to LRI or pneumonia, where it's almost too late, especially with the mechanism of action of Presatovir. But if you treat early on, and if you treat the patient who really need to be treated, and I'm talking about heavily immunosuppressed patients with probably lymphopenia, or early after transplant, after allogenic transplant, like let us say within 6 months or within a year, then you will see an antiviral effect from Presatovir in a subgroup analysis where there is an impact on RSV outcome, which was the viral load as well as reducing the amount of the incidence of lower respiratory tract complication in patients who came in with upper respiratory tract infection. So there were some lessons learned and how to design new trials. So stay tuned. We're pretty excited about new trials coming our ways for a new antiviral against RSV, where a phase 2, at least 2 or 3 phase 2 will be conducted, and already some started to try to reduce the impact of RSV in our immunocompromised patients. So it's pretty exciting time also coming our way for other antiviral for RSV.